force. This morning, the doctor is in to talk about the dangers the insects pose to you and your family's health. Good morning, Dr. VJ. If you notice, the Dr. VJ is not in his scrubs. He's in his running outfit. He's going to be participating in the Harbor Half Marathon that goes on this morning.
Yep.
You might see a few mosquitoes out there.
Yeah, maybe.
Now, I guess the first thing we ought to talk about is how dangerous are the mosquitoes? What can they actually do to someone, and what are some of the different diseases associated with them?
Well, right now in the U.S., mosquitoes can't really, they haven't been shown to transmit much in terms of the real dangerous diseases that we normally hear of being associated with them, such as malaria, dengue fever, and yellow fever. We don't have much or really any documented cases of mosquito transmission. Of course, there is West Nile virus that we heard about a few months ago, but right now we don't have any documented cases in South Texas.
But you said that they, I believe you've said they are possibly moving into the United States.
There are different species of mosquitoes. There are certain species of mosquitoes that are associated with malaria, and there's another species of mosquitoes that's associated with the yellow fever and dengue fever. Years ago, these issues were present here in the southern part of the United States. Malaria, dengue fever, yellow fever certainly was present, but we haven't had any documented cases, as I said, for quite a while. But that specific type of mosquito that can transmit the yellow fever and dengue fever has been found in California. Now, just finding that kind of mosquito doesn't necessarily mean that these other diseases are far behind, but it certainly does raise an alarm bell, and our authorities are out there trying to get rid of these mosquitoes.
And how dangerous are these different types of, because people haven't had yellow fever or had to worry about this stuff, so are there cures for these things? And
yellow fever has a vaccine, so there's no real cure. Once you get either of these, then you have to get medical care until your body fights off the infection. But yellow fever has a vaccine, dengue fever does not. So the best thing is prevention. Best thing is to avoid being bitten by mosquitoes. Now, how do you do that? Mosquitoes are most active at dawn and dusk, so you want to try to avoid being out there at those times. The other thing you can do is obviously stay fairly well clothed so mosquitoes don't have purchase to as much a part of your body. And then the third thing is to use some sort of an insect repellent. The most common ones involve either DEET or certain kinds of plant extracts. DEET is safe except for children under 2 months old, and so long as you don't spray it around the mouth and anywhere around the face area. And you need to reapply it, once a day or so. And then there's other factors or things that we have, which are plant extracts, which are safe for children over 3 years old.
Okay. Well, hopefully you will stay mosquito-free, and maybe throw some DEET on yourself, but I don't know with these temperatures, maybe the mosquitoes aren't going to come out.
Yeah, I think they're sleeping.
They probably should put them to sleep if we could just keep the weather like that during the summer. Well, thank you, Dr. VJ, again. And remember, any and all medical questions you have for the doctor can be answered if you send us an email or Facebook